Wanted to share my experience about doing virtual visits. I remember when I first got started doing virtual visits, I didn't really have much training. Someone just said, "Hey, you're going to see Mr. So-and-so today, and you're going to, oh, by the way, you're going to see him virtually." So I wanted to help teach you how to not make some of the same mistakes that maybe I did early on in my career doing telemedicine. So before you get started, before you get connected, I just want to go over some really basic things. Make sure you're dressed professionally. So white coat on is encouraged, badge on is always great as well, just so the patient can recognize that you're the person that they actually sign up to do this visit with. Also, you want to make sure that you're doing the visit in a HIPAA compliant room. So if you're working from home, make sure the door's shut, make sure that you have no interruptions. There's nothing worse than having a good visit with someone and then it being interrupted by someone, even if you're at home or at the office. So if you're at home, make sure your family members know not to bug you, that you're really having this is a time when you're going to be seeing patients. Another distraction that's common are phones. So make sure the phones are on silent, not buzzing, not ringing, nothing like that. You want to pay all your attention to the patient during these kinds of visits. So speaking of ways to make sure that you're paying the attention to patients, really make sure that you've got good eye contact. And one way to do that is to make sure that your camera is set up at eye level, and that you're speaking directly at the camera, not necessarily looking at the screen. You want to be looking at the camera when you're speaking. This will help with a good audio connection too, or a good way for your patients to be able to hear you, because generally the microphones and a lot of the cameras that we have are right next to the camera. So if you're speaking at the camera, you should be speaking at the microphone too. So once you get connected, the first thing you want to do is make sure that the patient can hear and see you okay, and that you can hear and see them okay. It's a good time in the beginning to make adjustments. Sometimes you have to turn your volume up. Sometimes you might have to speak a little bit louder. You don't want to be speaking too loud. So you just want to make sure you're both got a good connection where you're talking and both sides can be seen and heard very well. There's nothing worse than having a connection where can't hear or see the patient. It just really makes for a very choppy experience, and you lose a lot of value in the visit if you're not having a good connection. Reaffirmation is another thing that I've noticed is a good thing to do with these kinds of visits. The patient really needs to know that you can hear and maybe even see what they're showing or telling you. So nodding is a good thing to do, sometimes repeating back what they say, especially if maybe you want to clarify, maybe the audio cut out for a minute and you just want to make sure that you got the full message, that's been heard loud and clear. Another thing maybe not to do is something that I think we all can be guilty of, even in non-virtual visits, is doing the whole charting while you're talking to the patient. So this is especially true, I think, online, because you give the message of maybe kind of shaking your head kind of negatively. So it's kind of a negative message, and sometimes if you're talking, the microphone isn't going to pick you up because you're not looking right at the camera. It can make for a kind of a choppier experience as well. So try your best to just kind of have a conversation with the patient, write down some things if you need to, and then maybe finish the charting, at a later time. This way you can show the patient that you are listening, you are engaged to the patient, and make sure that they know that you're hearing everything that you want to tell them. So physical exams, another thing I think that a lot of people don't realize the capabilities of what we can do online. I know I'm guilty of that, or I was guilty of that when I first started. Sometimes you got to think a little bit outside the box, but remember that the physical exam, with the video and audio capabilities that we have, can be very valuable. So, for instance, when you're doing a physical exam, you do want to make sure that you're showing the patient exactly what to do. If you say, "Hey, I want you to tap on your sinuses," the patient may not know where their sinuses are. So you want to show them where the sinuses are and demonstrate exactly what you want them to do and guide them through it. And don't be afraid to redirect them, and don't be afraid to get up out of your chair and show patients, if you want to have them examine their back, that you can stand up and walk around, have a little bit of fun with it. It doesn't have to be you just sitting at a chair, just really, really kind of tight and stoic. You really can have fun with it, and it allows for a better patient experience. Um, Another thing that I think is really important is when you're getting the information from your patient is really ask a lot of questions. Really make sure that you've got the whole story, because our HPI, or our history gathering, is really, really vital in this setting. We can't reach through the screen and put a stethoscope on a patient, or touch the patient. So we really have to gather as much information as we can through the conversation. I often will tell patients, this is our most valuable part of the exam, and new providers as well. Do a really thorough job with your history taking, as you should always, but really, really, pay attention to that with these virtual visits. And then another thing that I've heard from other providers, and maybe even the way that I would go through visits when I was first starting, is don't feel like you have to be quick or rush with these visits. You spend some time. The whole idea really is that you're doing these visits, and getting the information. And often the big benefit to it is that the patient's at home or in a place that they're comfortable. You may notice a patient that you've seen in the office before, and then when you see them on a virtual visit when they're at home, they're more laid back, they're more comfortable. Sometimes they're even more honest with you. They give you a little bit more information. So, the idea isn't to have like a quicker visit. It really can be a longer, meaningful visit, and a good visit, where both sides are really able to communicate effectively. Another way that you can ensure that you're getting all the information and that the patient feels comfortable and that you've gotten everything is to allow the patient to be aware that they're the ones to end the visit. So, for instance, make sure that you give them the opportunity and ask if there's any more questions. Is there a family member perhaps in the room that has a question? It's a good practice to allow them to end the visit. This way, you know that you're not cutting them off. You don't want to hit that end button and the patient's just going to say, wait, one more thing. You want to have the patient disconnect the visit. This way, you know that they got everything out that they wanted to ask and talk to you about.